Hello, this is Jeff Williams, CEO of Health Choice of Georgia. You can visit us online at healthchoiceofgeorgia.com. Last night, the President of the United States had a chance to correct his misstatements about how we could keep our health plans and our doctors if we like them. He had the opportunity to do this, but he didn't take it. Instead, he continued to demagogue the issue and call his detractors the ones who were distorting the facts. He even went so far as to revise his much-repeated promises, inserting convoluted caveats about how we could keep our health plans. Then he had the audacity to tell us that this is what he'd been saying all along. If there were ever to be an embodiment of the emperor wearing no clothes, this would be it. As many of you know, but far too many of you do not, in March of 2010, the Affordable Care Act was passed. It included a grandfather clause that said plans that existed before that date could be retained as long as they were not materially changed. At that time, the legislation laid out a time frame that all new plans would be required to meet Obamacare requirements, and it mandated that the insurance companies change their plans in order to comply with the law. It was at this point that the administration and the lawmakers that voted for this law knew that no one would be able to keep their plan, even if they liked it, because this very law required the changes that negated or voided the grandfather clauses. Myself and my colleagues in the industry knew that right at this point. So how could the President and his advisors and the lawmakers that voted for this law not know that? I think they did know, and I think that's one of the reasons they exempted themselves from this travesty. There are many, many people out there who get their health insurance through their employer, and they don't understand what all this fuss is about. The cancellation letters you're hearing about in the press every day, those are from people who obtain their insurance through the individual market. And these are just the people whose policies are expiring in the first quarter of 2014. These notices will continue to come for the next year. The individual market is 15 to 20 million Americans, an incredible amount of people, yet only 5 to 7% of the health insurance market. The President continues to say that only a small amount of people will be negatively affected by his Obamacare changes. He knows that this is not true. What people do not yet realize is that this will only be the tip of the iceberg. When the employer mandate provisions kick in, the number of people losing their existing plans will skyrocket. Employers have already run the numbers, and many of them confirm that if the exchanges exist, they'll simply cancel their group plans and pay the Obamacare fines. It'll be much cheaper for them. And in business, that's what you look at. You manage your bottom line. When this happens, millions and millions more Americans will be forced to obtain new health insurance plans on their own, and the individual insurance market will have already been co-opted by the Obamacare mandates. Did you ever wonder why the President, without congressional approval, delayed the employer mandate, but not the individual mandate? Why he gave waivers to large employers, again without congressional approval? It was because he knew that tens of millions of people would lose their employer health insurance. He's trying to get us so far into this mess before the masses realize what's going on that we can't get out. So whether it's that our President is the emperor with no clothes, or whether it's, as Bill Clinton said, that this is the biggest fairy tale he'd ever heard, we need to fight this every step of the way. It's bad policy, it's bad law, and it's bad for America. Thank you.